I'm in New York City, which is the epicenter, and I'm not on the front lines, but from friends and colleagues on the front lines, it's been really hard. Hospitals have been overloaded. People have been really sick. It's been a major problem. What I'm seeing in my practice or hearing from in my practice are people who either haven't been that sick. A lot of the people who actually haven't been that sick and who have had it often have had a healthy lifestyle, been taking certain supplements, which is obviously anecdotal, but I'm definitely hearing that. The second pattern I'm seeing is people seem to be, or some people seem to be having this for a long time. They seem to get over the initial infection and then they get reinfected, or something secondary happens that can last for a couple, not just usually a week or two. Sometimes it goes on for 3 weeks, even in longer, some people. The other pattern that we're seeing is that generally the healthy people, or what we would call metabolically healthy people, are doing better, and the people who are dying or not doing so well are people who have diabetes, heart disease, obese, chronic illness, but generally what we would call metabolically unhealthy. Those are the patterns we're seeing. And lastly, social distancing definitely works. I mean, New York, we seem to have hit a peak. It seems to be going down. So we need to continue doing that. And as it spreads throughout the country, that's what I would tell you what's happening in what I'm seeing in New York.
Well, it's definitely here. We haven't been hit nearly to the same level as New York. I think the whole state of Colorado's got confirmed around 6,500 cases. And, you know, the experts are saying there's probably at least a 10-to-1 ratio of people that haven't been confirmed. So that means, you know, we maybe have 65,000 cases or so. In my area, Boulder County, there's, you know, a few hundred cases and only, I should say only about 10 deaths. You know, when would you ever say only 10 deaths as, you know, something to kind of downplay the significance of something? Well, that's just in comparison to New York. So we just haven't been hit as hard. And the whole question is whether we started social distancing early enough to have already begun to flatten the curve. The big question that goes on in Boulder, in my community, which is now not quite a ghost town, but the streets are quiet. You know, we have a lot of shopping areas and a downtown mall that's world famous that, you know, normally packed with people, especially this beautiful springtime of year. And we have lots of athletes. You know, people are here from all over the world to train, you know, bike racing, runners. And so the big debate that's going on right now is, what can you do? How can you safely get outdoors? And, you know, if you're jogging, even if you've got a mask or even just a bandana on, is that enough to protect the other people that you could potentially infect if you're asymptomatic? You know, there's not much debate that if a person has got symptoms, if they got a fever and a cough, then they should stay home. But what about somebody who feels fine? You know, potentially is infected but doesn't know it. Are you going to tell them to stay home? And so the whole question is this sort of seesaw between your mental health and your physical health. If you stay home, you know, for months on end, you never go outside, that's pretty bad for your mental health. So, you know, we're really kind of in the midst of a discussion, and we've got a lot of atmospheric researchers in Boulder. So the kind of discussions that we're having about aerosol transmission, the slipstream, you know, what happens when somebody's just breathing out hard, what kind of particles are being released. People are talking about it on the level of physics. They're not just saying, hey, I think you should stay home or whatever. You know, they're talking about particle dispersion. And I'm seeing these discussions on the local board, something called Nextdoor, discussions about particle dispersion and, you know, dynamics of airflow and things like that. So that's what's going on in my area.
There's two pandemics. There's the pandemic of COVID-19, and then there's also the pandemic of the anxiety and the fear because of the virus. And we can't control the virus per se, but we can control our reaction to it. And the way we do that is by learning relaxation techniques. So for people who are hyper and can't sit still, exercise, yoga, any type of movement, dancing around your living room, listening to some Bob Marley, anything like that can be helpful. But anything to activate the parasympathetic nervous system. So I'm a huge fan of meditations, changed my life. You know, we tell people to use apps like Headspace,
yeah.
Insight Timer, Journey Meditation. There are all these apps that you can use that are having meditations. The Well actually has classes, meditation classes, yoga classes. There's so much going on. I mean, I think it's an interesting time because this is a really good time to actually start creating these new habits. Because the other thing I'm seeing with patients is that people, I'm seeing New Yorkers who are pretty like go, 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 go. And their routine, they can't come to terms with slowing down because they're so used to getting up early, going to the gym, doing the, you know, I have so many of these women are these super women who, you know, have kids and husbands and jobs, and they're struggling with the slower lifestyle of this. It's a little bit different in Boulder, I'm sure. And I think the loss of their routine is a big thing. So what I'm encouraging people is to try create some healthy habits, you know, new routines, because you're going to be living like a variation of this for a long time. So try go to bed at the same time, try wake up at the same time, eat meals at the same time, get some structure and routine in your life, and start developing new habits like meditation. So it's an interesting time because we can use it positively. I know it's a difficult thing to do, but we can use it positively. I mean, as Bob will say, I mean, all the stuff that we're recommending now is stuff we've been recommending for the last 20, 30 years.
You know, the $1 million question here is, why are so many people asymptomatic or minimally symptomatic with the infection? Why aren't we studying that more? Why isn't that the number one thing we're studying? Is what's different about the immune systems of those people that, you know, maybe they lose their taste for a week, or they cough a little bit, they get a fever, and then they're fine.
Yeah, exactly.
What's different?
This is anecdotal, and I'm not being like Trump and saying this is the cure, because it's a tricky thing. I mean, everything's become so politicized. But what I will say, I have gotten so many emails from patients thanking me for getting them to go on a low carb diet, for eating well, for meditating, for dealing with their stress, for, you know, I use NAC, I use quercetin a lot, I use curcumin a lot, for putting them on these supplements, which I actually do believe help. I mean, I can't say for sure. I'm not going to get up there and say this is a cure, but I am, you know, I've got to say I'm pretty confident that, as Bob was saying, these patients who've actually changed their lifestyles, are eating well, and are taking these supplements seem to be doing much better. So there's got to be something there. And as Bob says, why aren't we studying those people?
You know, when I was in my medical training, you know, they talk about what do you do if you come upon someone who's unconscious, and they talk about the ABCs: airway, breathing, circulation. Well, I talk about the ABCDZ, right? Vitamin A, vitamin B, vitamin C, vitamin D, and zinc, you know, provide this foundation of nutrition that I think help everyone's immune system work better. You know, people ask me, well, if I get sick, should I start taking vitamin C then? I'm like, why would you wait until you're sick? Why not start the vitamin C now? There's pretty good data that vitamin C keeps your immune system in tip-top shape. Same thing with vitamin D. Same thing with just basic B vitamins. You don't need massive amounts. but just covering the bases for your B vitamins. All of those things are really critical. And just a little bit of zinc, you know, you don't need hundreds of milligrams of zinc. You need, what, 50, 60 milligrams. I would say some of the best research is on quercetin. And, you know, what is quercetin? It's well, besides being one of my all-time favorite supplements going on 35 years, I've been prescribing it for that long, is a yellow pigment that's found in most fruits and vegetables, but especially rich in apple skins and onions, especially red onion skins. So, you know, onion soup is a really good source of quercetin. But most people, if they're eating salads, they're getting quercetin. So, you know, you're already eating it in your diet. But it was discovered years and years ago that quercetin is a really good immune supportive agent. Some of the early research was on allergies, because quercetin stabilizes a type of white blood cell called mast cells. Mast cells release histamine. Histamine is what causes all that nasal congestion and sneezing that you get with allergies and with a cold. The one thing about quercetin is that it's very poorly absorbed. So you have to take a lot of it if you're just buying straight quercetin powder. We're talking 3,000 milligrams or so a day. But there was a study on quercetin phytosome, which is quercetin that's bound to sunflower lecithin. And that study showed that it dramatically enhanced the absorption of the quercetin. So if you're taking quercetin phytosome, you need generally 1 or 2 caps once or twice a day. It's, you know, inexpensive, safe, non-toxic. Kids can take it. Little kids can take it. So it's my top supplement where I just think everyone should take this. And then, you know, if there's any indication that an infection is coming on, you can triple that dose. You can do like 500 3 times a day. Frank, you use quercetin, don't you?
Yeah, I mean, I've been using it more often now, but I haven't used it as much as you do, but I do. And now I've been taking it as well. But I use it, but I'm actually starting to use the Thorne, you know, quercetin phytosome, because, as you said, it's better absorbed. I've usually been using it in other formulas, and obviously it's not enough. But thanks for that.
You know, there's a pretty good reason to believe that that quercetin is a worthwhile thing. Now, I'm not saying, hey, just take the quercetin and you're done. I'm just saying that's the top of my list, right? I think the more the merrier. Like, this is a soup here of immune supportive agents.
You know, vitamin D obviously is one of those nutrients. Also, you can measure it. You know, we see so many people who have low vitamin D, so we can assume that most people need vitamin D. What I'm actually recommending to people who don't have their levels measured, just take 5,000 a day in the meantime anyway. 5,000 a day, although some people say it's too much. I've never seen a overdose on 5,000 at all. The most important thing with vitamin A and vitamin D is they're fat soluble. So what I hear all the time, people take it and they're taking it with a salad, or they're not taking it with fat, and then it's not going to be absorbed. So the important thing about A and D, you need to take it with fat. Otherwise, you're not going to get any D into you.
So the interesting thing about vitamin D is that if the immune system is under functioning, and you add vitamin D, it brings the immune system up to normal functioning level. But if it's over functioning, it actually down-regulates it. It decreases the activity of vitamin D, which is why it's been used for autoimmune diseases like multiple sclerosis, right? So vitamin D is, you know, you could call it an adaptogen. It's really a hormone, not, you know, we think of it as a dietary supplement, but it's working like a hormone that regulates the immune system. Now, this is an important point because I saw a paper that came out of the University of Arizona Integrated Medical Center where they were saying, you know, be really careful with vitamin D because it could cause a cytokine storm in people that have COVID-19. You know what? I've never seen one study that says that this happens. Right? It's totally fantasy. There's also a pretty famous nutritionist named Chris Masterjohn who says, if you're taking vitamin D and you get COVID-19, you better stop it immediately or your immune system's going to go haywire. There's no evidence that happens. There's just none. And so it's total speculation. I'm seeing a lot of this kind of speculation out there. Don't take elderberry if you got COVID because it'll make your immune system go haywire. Well, show me the evidence. You know, if you take your immune cells and put them in a test tube and add some elderberry, it activates the immune cells. Well, that's what you want. That doesn't mean that herbs like elderberry or echinacea or andrographis or any of these immune boosting herbs, that doesn't mean that if you take them, you know, over a period of days that your immune system is going to get boosted into the universe. You know, it's not going to skyrocket into the universe. It's not, it doesn't work that way. It's a fundamental misunderstanding of how these herbs work.
Well, you know, we can assume it plays an important part because there's so much of your immune system is around the gut. And you know, the problem with the gut is it's a real crapshoot. You don't know what you're doing. So, you know,
so to speak.
Yeah. I actually recommend prebiotics now more than probiotics because probiotics are very tricky. I mean, I've seen, you know, probiotics, some people do great and some people makes no difference and some people actually can get worse. The probiotics I've, over the years, seeing more and more problem. I'm all for probiotics. I love probiotics, but they're trickier with each person's gut. Prebiotics seem to be a much safer and more effective way to treat the gut. I mean, that's where I'm at in this day and age. I don't know. I mean, it seems to be where I'm heading towards. What do you say? But I just find it a little bit easier for people to incorporate prebiotics, or less of a problem, put it that way, than, you know, probiotics I see sometimes people have problems with.
Well, I agree to some extent. I would say that I don't really see serious problems with people reacting to probiotics. It's more an issue of not knowing exactly which one to use. I think that's the biggest issue.
Interesting. Just to clarify, I think that's a good point. But when I say I'm seeing people have problems, it's more a lot of gas and maybe some diarrhea, not serious problems, especially with people with SIBO. So thank you for clarifying. When I'm talking about problems, it's more, you know, gas, maybe diarrhea, maybe some other minor, not major problems, but, you know, they're just harder to pick, put it that way.
Yeah. So I like to have, say, 3 or 4 products that I rotate through, and I'll tell the patient, you know, if you have any kind of intestinal reaction to one, then we can switch it to the other.
Right.
You know, and so I kind of rotate through. So I'm using the probiotics in this case as a way to boost immunity, you know, and so it must be working through the gut microbiome, even if we're not dramatically changing the gut microbiome the way that prebiotics do. They're still doing something. I think of probiotics as kind of seeding the clouds. The important thing is that it's not necessary to have massive doses to get this effect. The study on probiotics for preventing respiratory infections, you know, they only use like the 5 billion CFU range. And I think maybe some of the people that are having the problems are the ones that are saying, well, you know, I need 100 to 200 billion CFUs, 500 billion CFUs, you know, because more is better. Well, more is not necessarily better.
Right.
So you're seeding the clouds.
Yeah, there's no question that it's working. I mean, we can see it in New York, and why social distancing works is I'm obsessed with this viral load concept, that the amount of virus you're exposed to, if you social distance, you're not re-exposing yourself to virus all the time. So I think that's part of it. Why it flattens the curve is if you're staying away from lots of people, you're not having a lot of people infected all at the same time, which is what the problem has been in New York or Italy and Spain. It overloads the hospital system. So what the benefits of not flattening the curve, not what I'm suggesting, is the only way we're going to get past this is, or on a country level, is when we have herd immunity or maybe a vaccination. So I think the herd immunity will come about quicker because we've had so many infections, whereas a place like Australia, where they've managed it pretty well, but they're going to have years and years of probably smaller outbreaks and not so much of a problem, because the herd immunity will take longer to build up. What happens is, let's say I have the virus and I give it to 5 other people and they develop antibodies to it. And herd immunity means you become immune to it by developing antibodies. And I think a lot of us probably have them or have been exposed and have them just by being exposed to other people. The more people that have the antibodies, the less of a problem it is. And I think the future of how we're going to stop social distancing and get back to life is actually probably measuring antibody levels. I mean, I think probably everyone should have antibody levels checked, and that can determine, what you can do. But we still don't know how effective those antibody levels are, because I just saw something out of Korea that people are getting reactivated. So, but theoretically, once you test someone and they have antibodies, they shouldn't be getting the infection again, theoretically, but all things are off the charts now. So I'm not sure what the story is with coronavirus, but that's the theory. So sorry, I'm going off question here. But I think social distancing definitely works because you're staying in your own, your own little circle. You're not spreading the virus. You're not being exposed to the virus. And with a lower amount of people being infected in a small amount of time, you're not overloading the hospital system, which is what happened in New York and is probably going to happen in more and more places across the states. But Bob, I have a question. This viral load thing, why isn't, this is why I think these young doctors or doctors working on the front lines, especially without PPE, it's crazy, are getting sick because they're exposed, or the respiratory therapists in particular, they're exposed to such a big dose of the virus that that's hot. If you have, it's like, we don't say that with toxins, but the dose is the poison. What do they say? The dose is the poison. The poison is
the dose makes the poison. Yeah,
dose makes the poison. Right.
Right. Well, that's probably true for this particular virus. Is that infectious dose? That initial exposure probably explains why so many healthcare providers are getting seriously ill, which has happened all over the world. It happened in China, so in China, they said, well, it mostly affects old people and healthcare workers. These healthcare workers were younger. Well, they're getting blasted with these aerosols. So, the real question is, how much of a virus can you be exposed to without getting sick? And, it's going to take a while to figure that out. But if we knew that, that will answer questions like, well, is it safe to go for a walk if you're wearing a bandana? If you're not wearing a surgical mask, you're wearing a bandana, which presumably still gives you some exposure, is that really going to help? I do want to point out something one of my patients said to me yesterday, which he said, look, Bob, let's just clarify. We're talking about physical distancing, not social distancing. He said, I don't want to give up the social stuff because, I enjoy having my connections with you. And, more and more people are doing exactly what we're doing right now, which is talking by Zoom chats or, telephone, etc. I've even seen some bands do concerts.
Yeah.
And that's amazing, like how they time that so that they're actually playing together. So, in terms of our mental health, like as we physical distance, we need to figure out how to shorten the social distance,
Exactly.
but increase the physical distance.
I think that's a really important point. I think a really important aspect of staying healthy is staying connected. And, becoming lonely and depressed and being by yourself or not connected is an issue. So I think it's a great point. It's about physical distancing, not social distance.
It's the way it is. I will say that when I first decided to switch over, which wasn't a hard decision, but said, okay, I've got to see people, from home. I thought, well, I'll just call them on the phone. We'll just have a telephone conversation, which I've done on and off for years. But then I've gone back and forth between like doing a Skype call or a FaceTime call, and there's really no question that being able to see the person,
yes,
see what they look like, it's a huge difference. I would much rather have a video conference whenever possible.
Yeah, I mean, I think we've got to, a lot of it is out of our control, and you've got to, be aware of that. But there are lots of things you can control, and your reaction to the situation is the most important. So dealing with the anxiety and the stress and, moving your body, taking sleep seriously. What a great time to learn to sleep properly. So all these healthy habits that we've been recommending for years, good sleep, moving your body, dealing with the stress, whether it's meditation or yoga or whatever you use, eating well, all becomes a little bit more urgent now. You can't do that. The problem we're seeing in America in particular, in the Black and Latino communities and the poorer communities, are they unfortunately eat the ultra processed foods because the food industry makes it so cheap, and that's what they can afford. So this is, I'm hoping this is a time that we can, in the culture, look at all these issues, why this is happening, what foods are people eating, what is the food industry feeding us, and all, seeing what's important in life, getting your priorities right. I mean, I think this is a real good time to reassess not only your own life, but, what's going on in the culture and how we can change things moving forward. Because I am 100% sure this is not the last virus we're going to have to deal with. These are going to be coming, whether it's next year, in 5 years' time, we don't know, but this is going to be happening. So we need to, be able to be strong enough and strengthen ourselves in a way that we're going to have to deal with it. This is just the new reality. We're all going to have to deal with it. And hopefully what Bob and I have been teaching for years permeates the culture a little bit more. Hopefully the food industry changes. I doubt it, but we hope that hopefully people's priorities about what's important in life changes. I mean, these are all more philosophical concepts, but I think this is a good time to start thinking about it.
We've got to do something different. This situation is forcing us to look at our values, and that's what I want every patient to really think about. It's like, okay, the world is going to be different. We don't know what is going to look. There will be another side. We're going to come out the other side of this.
Yeah.
Right. There's no question that either we'll get enough herd immunity, we'll come up with a vaccine, something's going to change. This is not going to last forever. The Spanish flu, I think, lasted 2 years, right? And then died down. Hopefully this won't last that long. It is a finite phenomena, but what's not finite is what happens to our society on the other side.
Yeah.
And so we all need to be thinking about what that's going to look like and how we're going to live together as a civilization. We need to reevaluate the entire planetary civilization. We don't have any choice but to do that.